Lupus is an autoimmune disease where the immune system mistakenly attacks healthy tissues in the body. This can cause widespread inflammation and damage to various organs and systems. The most common form of lupus is systemic lupus erythematosus (SLE), but there are other forms, including cutaneous lupus and drug-induced lupus. Types of lupus: systemic lupus erythematosus (SLE). The most common form, affecting multiple organs such as the skin, joints, kidneys, heart, and lungs. Symptoms can be systemic and varied. Cutaneous lupus erythematosus primarily affects the skin, causing rashes and lesions. The most common form is discoid lupus, which causes red, scaly patches on the skin. Drug-induced lupus, caused by certain medications. Symptoms are similar to SLE but usually resolve when the medication is stopped. Neonatal lupus, the rare condition where antibodies from a mother with lupus affect the baby, potentially causing skin rash, liver problems, or heart issues. Symptoms: lupus symptoms can vary greatly among individuals but commonly include fatigue, persistent tiredness and lack of energy, joint pain and swelling, pain and swelling in the joints, often affecting the hands and knees, skin rash. A butterfly-shaped rash across the cheeks and nose is characteristic of lupus but not exclusive. Fever, unexplained fevers, kidney problems. Symptoms such as swelling in the legs, high blood pressure, or changes in urine. Chest pain, pain when breathing deeply, which can be due to inflammation of the lining of the heart or lungs. Hair loss, thinning hair or patches of hair loss. Sensitivity to sunlight. Rashes or worsening symptoms after exposure to sunlight. Mouth or nasal ulcers. Sores in the mouth or nose. Neurological symptoms. Headaches, confusion, or memory problems. Causes and risk factors. The exact cause of lupus is not known, but several factors may contribute. Genetics. The family history of lupus or other autoimmune diseases can increase risk. Hormones. Lupus is more common in women, suggesting hormones may play a role. Environmental triggers. Exposure to sunlight, infections, certain medications, or chemicals might trigger lupus in genetically predisposed individuals. Immune system abnormalities. Abnormal immune system function may contribute to the development of lupus. Diagnosis: medical history and physical examination. Evaluation of symptoms, family history, and a physical exam to check for signs of lupus. Laboratory tests. Anti-nuclear antibody ANA test, a common test used to detect the presence of antibodies that may indicate lupus. Anti-dsDNA and anti-Smith antibodies, specific antibodies that are more closely associated with lupus. Blood tests, to assess kidney function, blood cell counts, and other markers of inflammation. Urinalysis, to check for kidney involvement. Imaging studies. Chest X-ray or CT scan, to assess lung involvement or other complications. Ultrasound, to examine internal organs, such as the kidneys. Biopsy. Skin biopsy, if cutaneous lupus is suspected. Kidney biopsy, to evaluate kidney involvement. Treatment and management: medications. Non-steroidal anti-inflammatory drugs and SAIDs for joint pain and inflammation. Antimalarials, such as hydroxychloroquine, used to manage skin and joint symptoms. Corticosteroids, to reduce inflammation and control symptoms during flared UPS. Immunosuppressants, to suppress the overactive immune response and manage severe symptoms. Lifestyle modifications. Sun protection, using sunscreen and wearing protective clothing to prevent sun-induced flares. Healthy diet, maintaining a balanced diet to support overall health. Regular exercise, to maintain joint flexibility and overall well-being. Monitoring and follow-up. Regular check-ups with healthcare providers to monitor disease activity and adjust treatment as needed. Supportive care. Physical therapy, to help with joint pain and mobility issues. Psychological support, counseling or support groups for emotional and mental health support. When to seek medical help if symptoms worsen or new symptoms develop. For regular monitoring and management of the disease. If experiencing severe symptoms such as chest pain, difficulty breathing, or significant changes in kidney function. Conclusion: lupus is a chronic autoimmune disease that requires ongoing management and care. Early diagnosis and appropriate treatment can help manage symptoms and improve quality of life. Regular follow-up with healthcare providers, lifestyle adjustments, and medication adherence are key to managing lupus effectively.